Orthodontic important questions for final year. These are the most important questions that you need at the last of your exam in the final terms. These are the most important questions that are usually asked in the university's exam. If you need to pass, you need to know all these questions and answers. One more important thing is that diagrams are really important. If you're gonna draw a diagram in each and every question, you're gonna pass with a very good score. So let's begin. First question: describe importance of medical history for CD patient. Pre-prosthetic surgery, diagnostic cast, define complete denture impression, discuss objectives and various theories of impression making. Describe selective pressure impression technique in detail. Describe various important theories in complete denture. Stress bearing areas in maxilla and mandible. Describe anatomical landmark of edentulous ridge in maxilla of complete denture patient. Very important question. What is PPS area? Describe its function and relation with complete denture. PPS is very important, can also be asked in 5 or 4 marks, even in 15 marks question also. Retromolar pad and papilla. Role of retromolar pad in various steps of complete denture construction. Buccal shelf area, very important. Alveolingual sulcus, very important. Neutral zone, very important. These are the 3 questions that comes in 4 or 5 marks. What are the types of jaw relation? Write in detail about different methods of recording vertical jaw relation. It's a 15 marks question, very frequently asked. Phase bow, it's a 4 or 5 marks question. Phonetics, centric relation. Define centric relation and its significance. Describe various methods of registering centric relation. It can be asked in 15 marks even as well as even in 4 or 5 marks. Christensen's phenomena, very important for 4 and 5 marks question. Discuss articulator in detail. Write briefly about commonly used articulator, very important. Classification of articulators, it can be 4 and 5 mark question. Average value articulator, semi-adjustable articulator. Discuss interior and posterior tooth selection in complete denture. Non-anatomic tooth, theories of occlusion. Define occlusion. Discuss differences between natural and artificial occlusion. It can be asked in a 15 marks question. Define balance occlusion, very important, as 15 marks, even as a 4 and 5 marks question. Write factors influencing it. Compensating curve, dentogenic concept, SPA concept, all these are very important questions. Hanau squint, very important. Tissue conditioner, very important. These are all 4 and 5 marks question. Flabby ridge, epulis fissuratum, very important. Residual ridge resorption, rebasing, relining, very important. What are the different CD complaints? What can be their possible causes and treatment to correct them? It is a 15 marks question. Immediate denture, over denture, very important. Combination syndrome, very important, frequently asked. Even the Kennedy's classification is very important. Edentulous arches, cross arch stabilization, very important. Mouth preparation in RPD. Illustrate with the diagram parts of dental surveyor. Describe its importance and uses its step-by-step procedure of surveying diagnostic cast. It's very important that you know the diagram, otherwise you will lose the marks. Dental survey, a very important topic. What is the role of surveying for selection of different types of direct retainers? Surveying lying in RPD as well as surveying tool, very important. Factors determining path of insertion. Guide planes are very important. Mandibular major connectors, types of maxillary major connector, lingual bar major connector, very important topics. Define major connector in RPD, explain in detail mandibular major connector. It's a 15 marks question, very frequently asked. Minor connectors, Describe various components of cast partial denture. Classify minor connector and discuss them in detail. 15 marks question. Very important. Occlusion rest and rest seat. Very important as a 5 marks question. Rest position, physiological rest position, combination class, bar clasp. Very important. Combination classes asked very frequently. Direct retainers, very important. Principle of RPD design, selective grinding, rest seat preparation, special impression procedure in RPD, dual impression technique in RPD, very important. Stress breaker, support for dental extension. Discuss impression procedure for dental extension in RPD. 15 marks question. Classify partial denture conditions. RPS system, very important. 4 and 5 mark question. Post insertion care, 4 and 5 mark question, very important. Swing clock, partial denture, retainers in FPD, direct retainers in FPD, very important. FPD is very important. Classify retainers. Describe preparation of all the ceramic crown and maxillary center incisor. 15 marks question, very important. Veneers are very important in case of 5 marks as well as 15 marks question. Pontic design. Pontic is very important in FPD. Discuss in detail types of selection of Pontics. 15 marks question. Anti's law, pyre abutment, both are 4 and 5 marks question. Very important. What are the various factors in abutment selection of FPD? Describe in detail step-by-step preparation of maxillary canine to receive a complete coverage metal ceramic crown. It's a 15 marks question. Very important. Selection of abutment for FPD. Pyre abutment, tilted abutment, very important. Functionally generated path technique. Shoulder. Aesthetics in FPD. Finish line in FPD. Gingival finish lines, very important. Discuss biochemical preparation of tooth in FPD, very important in 15 marks question. Resistance form in FPD. FVC all metal preparation. What is the partial veneer crown? Discuss indication, contraindication preparation for 3/4 crown on maxillary cuspid with diagram. It's a 15 marks question. 3/4 crown preparation can be asked in 15 marks as well as in a 4 and 5 marks question. It's a very important topic. Classify bridges and its type, very important. Laminate veneers are also very important topic. Resin bonded prosthesis, cantilever, very important. Fluid control and soft tissue management, very important. Provisional restoration, temporary protection of prepared tooth. Die system is very important. Working cast and dies. Obturators. Altered cast method. Classify implant and implant design. Mostly this question is asked in perio, but sometimes they will shock you and give you this question, mainly in the prostho rather than in perio. So be prepared. It's a very important question. Sometimes it's asked in a 15 marks question. So osseointegration. Osseointegration comes in 4 or 5 marks question. Make a flow chart. It will fetch more marks. Thank you.